Ashwin Venkataraman. I'm a clinician scientist at the Centre for Healthy Brain Ageing. I'm a consultant in the Brain Health Clinic at South London and Waterloo NHS Trust. And I'm also leading one of the neuroimaging work packages on Predictor.
My name is Ana Beatriz Solana. I am Senior MRI Scientist at GE Healthcare and Senior PCT Researcher at King's College London. And in Predicton, I am leading the MRI biomarker discovery.
Well, MRI plays several important roles. Firstly, it's most useful for ruling out other conditions that could cause memory changes. Secondly, it's really important to understand how particular patterns of shrinkage that affect particular brain areas contributes to particular dementia, for example. And thirdly, in terms of research, we are able to use some of the cutting-edge brain imaging along with artificial intelligence to really predict some of the and detect some of those early brain changes before symptoms appear.
MRI is a very versatile imaging technique. It can allow us to see subtle changes in the brain years before the symptoms appear. We can detect early shrinkage on some vulnerable brain areas like the hippocampus, which is a brain structure which is key to memory processes, allow us to see changes in the functional connectivity of the brain. Also, advanced MRI can also pick up changes linked to inflammation or vascular health, which are believed to play a very important role in very early Alzheimer's disease.
Combined with other biomarkers, it will really allow us to understand a person's risk of developing Alzheimer's disease.
Multidisciplinary collaboration is essential to translate imaging innovation into the clinics and based on bringing the right people together. On one hand, academics help identify what are the most meaningful biological processes, while the industry focuses on developing robust, scalable, and usable tools that can be deployed in the clinical MRI systems. We have multiple objectives in Predicton. On one hand, we aim to identify and validate how effective the MRI established biomarkers are in identifying people at risk of developing Alzheimer's disease or that are going to progress faster to dementia. But also, we are developing and testing advanced imaging techniques that allow us to discover novel biomarkers that are more specific, more robust, more quantitative. Ultimately, we would like to also contribute to one of the key objectives of Predicton, that is making biomarkers more accessible. So our goal is to develop a faster and a smarter MRI protocol that allow us to extract and process the MRI biomarkers automatically, enabling routine use of MRI biomarkers in everyday clinics, even non-specialized centers.
If we can detect brain changes earlier, it allows us to intervene earlier. And it allows us to give the right treatment, allows us to give the right lifestyle changes and the right support to an individual. Early detection, it can be absolutely transformative if we get it right. It provides that early peace of mind to understand that the changes are real, and it allows us to really think about, well, what is the right treatment for an individual? I think importantly, it can be transformative because it gives people time. It allows them to understand and recognize exactly what the cause is, much earlier than they would have done. And they're not left with uncertainty. They're not left with not knowing what these changes are.